Hi, I'm Dr. Obermeyer, and the purpose of this video is to review anterior cruciate ligament surgery in female athletes. An overview will be had about female anatomy that may predispose certain individuals to these tears to the anterior cruciate ligament, as well as unique considerations for the surgical options, as well as activities and rehabilitation that can optimize your chances for a successful long-term recovery. We know that female athletes experience a risk of anterior cruciate ligament tear with high impact cutting and pivoting sports such as volleyball or basketball at a rate of 4 to 6 times that of their male counterparts. There are certain anatomical factors unique to female athletes, such as a narrower intercondylar notch or the space deep inside the knee joint that allows the ACL to pass from the thigh bone to the shin bone, as well as an increased Q or quadriceps angle, which leads to a higher degree of so-called valgus in the knee. Differences in the mechanics of landing, where the knee tends to want to collapse into an inward posture, can also contribute to risk of injury to the deep anterior cruciate ligament. And therefore, activities that strengthen the muscles of the hamstrings to improve neuromuscular activation can decrease the risk of injury and also facilitate a successful recovery following anterior cruciate ligament surgery. Female athletes also have a higher rate of so-called non-contact pivoting injuries in comparison with their male counterparts that more often have contact injuries where there is a direct blow to the knee leading to a ligament tear. These non-contact injuries frequently involve quick changing of direction in sports such as basketball or soccer and have a higher rate of load and rotation to the knee joint, which can lead to an ACL tear. If you are a young female athlete and have been deemed a candidate for surgery for restoration of your anterior cruciate ligament, an important consideration in a female population is the selection of the graft that is utilized to restore the ACL. Typically, there are a couple of options involving autograft or tissue harvested from your own knee that can be utilized for replacement of the ACL. The gold standard treatment historically is the bone patellar tendon bone graft. However, this involves a higher degree of invasiveness than other soft tissue grafts, including the quadriceps tendon graft, which has gained improved interest and probably preeminence in the female young athlete population due to its predictable graft size and excellent long-term functional outcomes with very low rates of re-rupture that are very similar to or nearly identical to the rates of re-rupture of the gold standard patellar tendon bone grafts. Other grafts, including hamstring tendon grafts, are typically less favorable in younger female athletes due to higher risks of re-rupture or failure of the graft. If you are a female athlete and have recently undergone anterior cruciate ligament reconstruction, it is important to adhere to a strict rehabilitation guideline to ensure that your mechanics for trunk stability as well as hip stability are optimized that facilitates improved control of the knee during landing and during cutting and pivoting activities during sport. Specifically, is it important to give your knee enough time to ensure the quadriceps is fully activated so that it can control the knee and prevent another injury. We also know that female athletes sometimes have a slight delay in their functional return, and oftentimes, especially in very young female athletes or in teenagers, we oftentimes will recommend that they wait to return to play until approximately 9 months following anterior cruciate ligament reconstruction surgery. Additional considerations in the young female athlete is ensuring that footwear or shoe wear during soccer or other turf-related sports does not have an undue adhesion or stickiness to the surface, so that may prevent the knee from having appropriate rotational freedom to limit a load to the knee that could re-rupture the graft or cause another injury. This can be specifically discussed with your physical therapist or with your surgeon. Thank you for your interest in ACL reconstruction surgery in female athletes, and please review our website for more information.